Hello, my name is Jasmine LaSalle, and I'm going to be talking about human papillomavirus. HPV clinical presentation. The human papillomavirus is the most prevalent sexually transmitted virus, causing various cancers in both sexes and anogenital warts in both men and women. The transmission occurs through intimate skin-to-skin contact primarily via vaginal and anal intercourse, making it a significant public health concern. In the US alone, HPV affects approximately 40 million men and women annually. The virus has over 100 strains with 13 oncogenic types capable of progressing to precancerous or cancerous conditions. HPV-16 is the most likely strain to cause cancer. Most cervical, penile, and vulval cancers are caused by HPV-16 and 18. Non-oncogenic low-risk strains such as HPV 6 and 11 are responsible for most cases of genital warts. Many people contracting HPV may not show symptoms and their immune system can naturally fight off the virus. However, the virus can remain dormant in the body for years before becoming active. Some signs that may indicate HPV infection include the appearance of anogenital warts or an abnormal pap smear. It is essential to get regular checkups and screenings to detect any signs of HPV infection early on. Pathophysiology. Did you know that the human papillomavirus is the virus that can cause uncontrollable cell growth and interfere with normal cell functions? This double-stranded DNA virus only affects epithelial cells and doesn't enter the bloodstream. However, HPV can modify DNA damage response pathway to replicate in host cells. When HPV enters the epithelial cell, the virus begins to make proteins that can interfere with normal functions in the cell, enabling the cell to grow uncontrolled and also avoiding apoptosis. It is important to know that there are various proteins involved in the complex interaction that underlies the pathophysiology of HPV. And also it is important to know that the women's cell biology changes throughout the women's life, and this makes females more susceptible to contracting HPV. So it is essential to be aware of the risk associated with HPV so that we can take the necessary precautions. Evaluation and diagnosis. Diagnosing human papillomavirus infection through visual examination of warts by a healthcare professional is a common practice. However, if genital warts are not visible, additional diagnostic testing may be required. The following tests are recommended. Pap test. So this is the collection of cells from the cervix, and it's been sent to a laboratory for analysis and the detection of abnormalities that can potentially lead to cancer. DNA test is conducted also on cervical cells and can recognize high-risk types of HPV. This test is performed in conjunction with a pap test in women aged 30 and over. So vinegar solution is applied to areas of the genitals infected with HPV and may be used to identify flat lesions that are difficult to visualize. Management of warts. Warts often go away without treatment, particularly in children and young adults. However, there's no cure for the virus, so they can reappear in the same or other places. Various medications are available to the treatment of warts. Typically, these medications are administered directly to the lesion, requiring multiple applications for optimal efficacy. Some examples include the following: salicylic acid, imicroid, podophylox, and tricolor acetic acid. So all of these medications are topic, and a common side effect of them is skin irritation. When medications cannot remove the warts, a physician may recommend one of the following procedures: cryotherapy, freezing the wart with liquid nitrogen, electrical therapy, burning the wart with an electrical current, surgical removal, or laser surgery. And this doesn't mean that the warts will not reappear again. Okay, now I'm going to be discussing management of HPV in the cervix. So in the event of an abnormal HPV or PAP test, a colposcopy may be conducted by an attending gynecologist. This procedure involves the examination of the cervix utilizing a colposcope, which provides a magnified view of the cervix. If any areas appear abnormal, the physician will obtain samples or biopsy to determine if any precancerous lesions are present. In cases where precancerous lesions are detected, they must be removed promptly. Several options include freezing, cryosurgery, laser, surgical removal, loop electrosurgical excision procedure, LEEP, and cold night conization. On this slide, I want to provide a visual of the loop electrical excision procedure, also known as LEEP. This involves using an electrically charged loop wire to remove a thin layer of a portion of the cervix. So on the picture below, we can see that the cervix with dilation, the instrument being used, and a very thin layer being removed, and then the area being cleared. The patient can expect to be placed in a standard gynecological position. The speculum will be used, a colposcope will be used, some solutions will be applied to be able to visualize those lesions, and then of course they will be using the electrical loop. On this slide, I want to provide a visual of the cold knife conization technique. So this technique entails various steps. However, the technique aims to remove a cylindrical shape of cervical tissue where the lesion is. Education and prevention. It is estimated that half of all individuals who engage in sexual activity will contract HPV at some point in their life. Factors that increase the risk of contracting HPV is having unprotected sex, having multiple sexual partners, and being younger at first sexual intercourse. Research has shown that sexually active teens and young adult females are at higher risk of contracting the virus than individuals over 25. Individuals with weakened immune systems, such as young adults with HIV, are high risk. Smokers are at high risk, and furthermore, individuals who have contracted herpes or chlamydia are more likely to be infected with HPV due to inflammation of the epithelial cells and breaks in the epithelial layer that provides a pathway for the virus to enter. According to the CDC, the HPV vaccine could prevent 30,000 cases of HPV a year. And it is advisable to receive the HPV vaccine at young age before engaging in any sexual activity. It is essential to use condoms during intercourse to avoid HPV and other STIs. Also, it's very important to maintain monogamous relationship and to stop smoking to avoid cervical cancer. Regular cervical cancer screening is recommended for women aged 21 to 65, and this involves getting pap smears to detect pre-cancer and potential HPV infection. It is important to know that there are currently no recommended screening tests for HPV infections in young men. To reduce the risk of HPV-related cancers, the FDA approved the first vaccine against HPV. Girls aged 14 to 26 and boys aged 14 to 21 should receive 3 series of the vaccines, while boys and girls aged 9 to 12 should receive only 2. In clinical trial, both Gardasil and Cervarix were found to be highly immunogenic. Resources for patients and families. Electronic resources for printout are great tools to educate our patients. For example, the CDC fact sheets. So there are quite a few of them. Genital HPV infection, basic fact sheet, HPV vaccine information for women, HPV in men, and also some information in Spanish. Infographics are also great tools that we can have posted in the office wall to educate our patients. There are also some websites that we can provide to our patients. For example, National HPV Roundtable that provides vaccines information and Gardasil patient information. Here are my references, so I hope that you enjoyed the video.